Kia ora. I'm Dr. Kim Hurst, the virtual care clinical lead for the Doctors Online and a co-owner at the Doctors Whakatipu in Queenstown. I've worked with Green Cross Health for 12 years. I've been on quite a journey with Green Cross Health over those years, and it hasn't always been smooth sailing, but that's the thing with any partnership. They've learned a lot from some of the challenges they had in the early days, and they recognise the importance of GP ownership in their practices. And they're encouraging that as much as possible, which is fantastic to see. I see it as a great opportunity to shape your own world and be involved in a bit more of the practice than just patient care, to really influence how you think care should be delivered to serve the needs of the community that you're part of. I was previously a co-owner for a decade at a practice in the Hutt Valley. That was sold to Green Cross and they became my new business partners. Sometime after that, my family and I were thinking about moving south. And when that opportunity arose to stay in the network, I grabbed it. I've always enjoyed working with the people at Green Cross Health. I've worked with Wayne, our GM, and Andrew, our ops manager, for a really long time. And now we've got incredible regional business managers that I really feel add value to our team. I started here as a full-time GP employee, and then there was an opportunity to revisit practice ownership, and I jumped at it. I thought it's a no-brainer. I'm going to be here for the next 20 or so years of my health career. Our young boys are super settled in school. We love living here, and I love working in this community. As healthcare becomes increasingly complex, I'm reminded that I wouldn't want to be a GP by myself. I'm happiest when I'm doing my best general practice work with the exceptional support in the background, and that enables me to deliver my best to our patients. I often hear corporate partnership and this vision of a nebulous big baddie that's coming to squish the little guy. In my experience, Green Cross Health really isn't that. They really support their GP ownership partners and they want to see them succeed. The reason I'm not in practice with other GP owners is that it can be quite hard to get them to want to invest. Whereas Green Cross Health are willing to invest in areas that are inevitably going to make GPs and our patients' lives easier. Those do bring with them some upfront costs, and some co-owners can be reluctant to want to do that. I've always felt that I'm a forward-thinking practitioner. From my UK military days, I was really used to working with non-GP roles, and I'm keen to make life as easy as possible for my patients and my medical team. I've been really excited to see our clinical team diversify and include extended care paramedics, nurse practitioners, and nurse prescribers. These roles are really the future of primary care in New Zealand. To get these roles up and running requires investment up front to help these people upskill and transition into primary care. Then you watch them become super competent practitioners supporting our GP workforce. At the Doctors Whakatipu, we've also recently installed patient kiosks. These record clinical measurements like height, weight and blood pressure. That's one of the things I'm most proud to partner with Green Cross Health on. They're not afraid to try new things and get behind them. In 2022, I was asked if I wanted to move into the role of virtual care clinical lead. And back then, Green Cross Health had a small, casual patient platform. I could see that even in its early stages, many of our practices needed additional support that this platform could drive, particularly in areas historically short of GPs. They're the same practices that I've seen struggle since I've been in New Zealand for 15 years. I wanted to see if we could offer a session or two a week to these practices that have been vulnerable in terms of manpower. And that really took off. So now we've got the Doctors Online practice support services with a full resource library of tools that can help practices at times of low manpower. This ensures these practices can continue to deliver healthcare to their patients. Most people assume that there'd be a big imbalance in the GP corporate partnership, that they just tell me what to do. But that's really not the case at all. As a GP working with Green Cross Health, we all have a voice at the table, and that's a true partnership. So if you're anything like me and you're keen to get involved, I'd encourage you to have a chat with the team at Green Cross Health.